few years ago, I started to have major health problems, including sight problems. And since I have a 70-mile round trip to go to the practice, this was causing real problems. I started maybe 2 or 3 years ago doing telephone consultations remotely. So I had whole surgeries set up. I used remote access. I used the electronic prescribing system when it came in, so that I could basically stay at home without having to drive to work and back, and deal with what I could. Telephone consultations being limited, you can't have a chance to examine people, you can't see their faces, you can't easily speak across a language barrier, because when a person translates to you, you're unable to actually look at the patient's reaction. So thinking about all those limitations, when the possibility of video consultation came out, I felt very enthusiastic about that. Setting it up, we had to think about it quite a bit. And I looked into the various bits of research that has been done about the best ways of doing video consultation. The most crucial thing is actually basically having 2 screens, which I've got before me, as you can see. So one screen is used for your remote access, so you have the patient's record in front of you as normal. The other screen is actually used for visualizing the patient. I've got my remote access set up so that I can send the electronic prescriptions. I've got access to ICE, to the results of investigations and all of those things. I can send dictations from home using Lexicon, and I can print out leaflets. I've got it networked to a printer in the practice where I can print out leaflets or any information that I want for the patient to pick up. So all of those things are things that you need to set up in the beginning before you actually start talking to the patient. What happens with the patients is that they get told the doctor will ring you this afternoon. So they have a slot of several hours where it's possible that that might happen, and they fit that into their normal life. To do that in video consultations means that if I get very tired, or if my eyes are bad, if there are any constraints like that, I can basically just take half an hour out in the middle, lie down, have a sleep, and go back to the work. And I've found that comparing my work on remote surgeries, video surgeries, with times when I do a surgery in the practice, the work that I do from home is better quality. So I think now we should go ahead and demonstrate what actually happens when I ring a person and then decide with them whether or not they want to have a video consultation.
Hello?
Hi Anna, it's Dr. Ford. I think you were expecting me to ring you, weren't you?
Yeah, I've been expecting your call.
Yeah, so what's the matter then?
I've got really bad back pain just at the bottom of my back, and it's stopping me from moving around. It's making it hard to get out of the car, to get off the sofa. I was just wondering if there's anything you could do. Right,
so it's causing you a big problem then?
Yeah,
I think
big problem.
With something like this, it would probably be better if I can see you. Would I be able to call you back on a video call, maybe? Hi, that's better. Can you see me all right?
Yeah.
Yeah, I can see you. So how long has it been like this then, Anna?
Probably for the last week or so. I've just had difficulty because I do drive a lot with
right,
and I think it might be brought on from that. But it's just difficulty. I can't do my long journeys anymore.
No. And you've not had it like this before?
No.
No. Okay. I need to ask you to do a few things so that I can just check how much your back is causing you a problem. Would you be able to lie down on the settee for me, do you think?
Okay.
If it doesn't get a lot better, as I said, you'll need the sick note, but also we have a spinal drop-in service where you can go for physiotherapy for some help. So if it hasn't settled down in 2 weeks, then we can give you the times for that. So the prescription will come through in about 10 minutes to the pharmacy. If you need them to deliver it, you can just ring them and ask them. And your leaflet will be at the practice. It's probably about 3 months now that I've been doing regular video consultations. I've found quite a few circumstances that they are particularly useful for. Now, obviously, for anyone who's housebound, You can have a normal consultation with them without them having to come out, as well as without you. With palliative care, end of life type issues, or following up patients who've been very sick when you need to see them again, or people who've come out of hospital. Basically, when people are very ill and you need to keep a check on them, it's very useful for that circumstance. It's also very useful for language barriers, as I mentioned earlier, because you can include all of the family in it if necessary. And with my patients, I think often consultations are with a family rather than with one person. So you can speak to all the family together, they can see you, and you can ask them, if you want to focus on one particular individual, you can ask them to actually focus onto that person so you can see that person individually. It's very useful for that. It's also, as you could see in the consultation that we've just shown, you can use it for examining a patient. Now, it's not the same as a full examination when you have that patient in front of you and you can touch them, but guided self-examination is actually very useful and perfectly adequate. If you have a senior doctor available, that doctor can supervise other staff. So for instance, I can look at a patient that someone else is seeing, a nurse practitioner or a clinical pharmacist. I can look at the patient remotely and advise them about that. I can see a patient at home and avoid the necessity for a home visit, particularly if it's a less experienced doctor who is not that certain about risk management on the phone. I can sort that out. The use of video has reduced the number of telephone consultations that go on to a face-to-face one. Previously, the care navigation was quite good, so it was only an occasional one that went on to face-to-face ones, but it doesn't really happen now. It's also, you can use it for assessing the risk in chronic disease situations. So somebody with chronic obstructive pulmonary disease, you can see whether they're cyanosed, you can see whether they're breathless at rest, all of that. So although you've got the limitation of not being able to listen to their chest, if someone else has listened to their chest in the last couple of days, you can follow that up and be very clear whether they're getting worse or not.